normal people when they get a little bit older. And so it also helps in creating lean body mass. And for those who do work out or do strenuous things in the yard, running, working out with weights, whatever, it decreases the amount of time for recovery and increases the the ability to have more energy to do those things that you're wanting to do. The ADA, the American Diabetes Association, gave Dr. Joe its most prestigious award for being the physician who has saved the most lives in the USA. He has 19 years of 0 patients having been admitted to the hospital and 0 having died from heart conditions, stroke, those type of things. And that's amazing. That is, who can say that? I really don't know. That record, I mean, it's 100%, not like 1 out of 3, 1 out of 100. Every single one. And that's the way this works. I know that some of you may seem a little skeptical about all this, and I would be too. But I was sitting there listening to these doctors, and they brought out a folder that was about this thick, and it was full of research that was documenting these things that were happening in the research. And so these papers are available for those of you who need that kind of proof. Now I have to say that I have a personal reason to be interested in this. It just so happens that about a month before I heard about this, I went to the doctor and I was told that I had plaque in the arteries around my heart. And that was kind of a wake-up call, knowing the history of my family. And so I don't know if it was kismet or, but it was brought into my life to find out about this. And so everybody has their own reasons, but that was what got me going. Dr. Joe worked with many formulas during these 19 years, and he kept improving on each one. But now he's so excited that he can bring this formula to the forefront. And this is the product itself. It's called L-Arginine Plus, and it's the culmination of all of his years of practice and study and improving the formula. And what it has in it, besides L-Arginine, they found out that the nitric oxide that the L-Arginine produced in the body only lasted for a very short time. And so it really wasn't as effective by itself. And there's been products with L-Arginine in it, and they knew that it was beneficial, but it had very little effect because it wasn't in the system long enough. But what Dr. Joe had found out is that if you put L-citrulline in with it, that's another amino acid, that when the body is using the L-Arginine to create the nitric oxide, that having the L-citrulline in there too, it turns in to L-Arginine. And so what happens is it's like a time release, and it keeps the nitric oxide being produced in your body for 24 to 36 hours at a time. And that is, with the dosage that you take, that makes all the difference. And so It has vitamin C, vitamin D. Now I mentioned that we were going to talk a bit about osteoporosis. Well, what they found about vitamin D3 is that it helps to keep the calcium in the bones, and so that's very, very important, because when the opposite happens, that's osteoporosis. Vitamin K, vitamin B6, vitamin B12, and folic acid. Now, the B vitamins, they're very good for the nervous system, and they are depleted in the body every day. They're water soluble. There's pomegranate in here that is a natural antioxidant, and because of the increased blood flow, that's it's easier for those antioxidants to really get through the system. What else? Oh, very important. Resveratrol, and you might have heard that being thrown around in the health studies that are going around. This is what it's taken from a red wine extract that you hear about the French people living longer. Well, they found that there's truth in that, and that is what resveratrol is based on. Also, Pro-Arginine Plus tastes great. Now, that was kind of difficult to do because L-Arginine tastes terrible. So they really have done a great job in making something. It's almost like drinking Kool-Aid, and but it's you know, good Kool-Aid. There's also silicon dioxide in here, and for those who don't know, silicon in the body is something that the body can transmutate into a natural calcium that the body can use. Now, would you rather have calcium that's, you know, put in a capsule that's hard to assimilate, or would you rather have your own calcium that's produced by your body? You just give your body what it needs and it produces its own. Here's something that most of us can relate to. How many of you out there have the genetics in your family of heart conditions, diabetes, those type of things? On my father's side, I know I'm one of those. My father died of a heart attack. My grandfather had a stroke, and the first time I was around him, he was incapacitated, and so I really never got to know him. And then he finally died of another heart attack, and my great-grandfather died of a heart attack. And so on my mother's side, it's diabetes and glaucoma, and so it's just something that it doesn't mean that because it's in your genetics that it has to be that way. If we're watching our diets and we're doing all the right things, good health can bypass those genetic traits. But for a lot of people, they're just living the average American diet, the SAD American diet, the standard American diet, which is SAD, S-A-D. And so that's some of the things that allows those predisposed conditions to come on. On the Pro-Arginine Plus jar, it states that it's 1 scoop in water daily, and I would say that would work, and it's not going to work as fast as if you took more, because you can't overdose on this. So I know people that are taking anywhere from 2 to 8, and 8's a little bit on the extreme side, but